this next interview. I'm really excited today to have a colleague, a physiotherapist colleague with me. This is Cara Claerhout, and she works at Pursuit Physiotherapy. And today we're going to be talking about something a little bit different. Well, not that different, I guess. We're totally going to be talking about pelvic health, but for men. So we're really excited about this topic. This is an area that is growing right now in physiotherapy. There's been a lot of chatter about women's health and women's pelvic health, but one thing that I think we need to grow into a little bit more, just get the word out a little bit more, is that there is also pelvic health physiotherapy for men. So Cara is our expert in men's pelvic health here in our city, and I'm gonna just turn it over to you and maybe just introduce yourself and tell us a little bit about yourself and where you work and that kind of thing. We'll start there.
I'm Cara Claerhout. I work at Pursuit Physiotherapy. I graduated from the University of Alberta in physical therapy in 1991. So I'm closing in on 30 years in this business. So I've done a variety of different things. Most of it has been orthopedic, so sports, injuries, that sort of thing. And what's been really interesting for me is how much of those skills are translating into the pelvic health region. There is a lot of overlap. So it's not like it's a brand new area for me, but a lot of the skills that we use are quite similar in the same line. So I work at Pursuit. I'm there 3 days a week. I'm not full-time, so I've got great hours.
Who works full-time anymore?
It's rare. I do have a husband and two almost grown sons, so I've got a lot of men in my life. I have a way of talking to them, so usually guys feel fairly comfortable with me.
Totally, yeah. And
I got started in this business basically because there was nobody in Central Alberta doing pelvic health.
Right.
So when I started looking at courses, I started looking at a line of courses that only did women, and then this other line of courses came up that was men and women. So I decided to go that area and just provide a service that doesn't seem to be around right now.
Yeah, there is a huge need. That could be a problem. We have only a little bit of battery.
Okay.
There's a huge need right now for men's pelvic physiotherapy. So we're going to dive right into that, and maybe can you kind of give us an idea about what exactly that looks like? First of all, I don't think men know that they have a pelvic floor.
Most men don't.
Yeah, this is like news break number one. Men have pelvic floors. Maybe you can talk a little bit about what exactly men's pelvic health is and what kind of conditions you treat, that kind of thing.
So men's pelvic health is a lot like women's pelvic health. It's a good function of your bowel and bladder control. It's also a control of any pain, any alteration in sensation like tingling, numbness, coldness. So I treat any pelvic pain actually in the pelvis. I treat anything testicular, penile, scrotal, discomfort, coldness, tingling, that sort of thing. I do treat the same things in men that we do in women, which is stress and urge incontinence. I deal with post-surgical issues, post-prostatectomy. I also deal with prostatitis or prostatitis, depending on how you pronounce it. I'm also trained in dealing with fecal issues, so either people who are constipated or people who are incontinent. So those are kind of my areas that I cover.
So I know that as far as prevalence-wise, this is it is very common for women to have incontinence issues, and people associate that often with childbirth. What are we looking at as far as prevalence with men?
So with men, most of the research has been done with the prostate. So men, by the time they're 60, approximately 50% of men will have issues with their prostate. By the time they're 80, that number jumps to 80%. So when guys come in, they say, this is really strange, this has never happened to me, nobody else I know that's going through this. A lot of guys are dealing with these kind of things. They just don't talk about it. Women, we chat about it over coffee.
Totally.
especially after childbirth. It's like, is this normal? Is that normal?
Yeah.
Guys don't seem to talk about it, and so they don't realize this is actually, some of these situations are very common, and they're also fairly straightforward to treat once we figure out what the root cause is.
Okay. So what is often the root cause? Let's go there. Yeah.
So, as with women's pelvic health, a lot of issues with men's pelvic health go one of two ways. Either you've got muscles that are weak and you don't have control over them, or they don't have endurance, or you're just not activating them in the proper way to give you the support that you need, or conversely, they're too tight, they're too active. They are so contracted already that they've got nowhere to go. So we really do need to do some investigation, figure out what's going on, and figure out how best to treat.
Okay. So does your clientele tend to be older? I'm just thinking if a lot of the clients are there for kind of prostate, and you do associate that a little bit more with older men. Is that true? Is that a myth?
I've seen anywhere from 20-year-olds to 80-year-olds.
Okay.
So it's not limited to a certain age group. I run the whole gamut.
Okay. Maybe just, is there different kind of root causes depending on age, or that's not even the case?
Usually the younger ones tend to be a little bit more hypertonic, meaning that they're grabbing on a little bit more, and the men, of course, as we get older, we lose muscle bulk, we lose muscle control, that sort of thing. The older gentlemen, that seems to be a little bit more of a problem, especially if they've had any kind of surgery.
Okay.
That tends to be more of a problem then.
Okay. Let's dive in for a second to prostate issues.
Okay.
And maybe you can define a little bit what those look like.
Okay.
And when, with men that do have issues with prostate, or prostatitis, or maybe a prostatectomy, so a surgery removing the prostate, or prostate cancer, what kind of things they should be looking at, and that would maybe direct them to receiving treatment.
So let's talk about what some of these conditions are first of all.
Yes, please.
So prostatitis is an inflammation of the prostate. The prostate is a gland. It surrounds the urethra in a man, and it continually grows and changes throughout your life. Prostatitis is, as I said, an inflammation, and there's 4 different subsets of that type of inflammation. 2 of them are bacterial in nature. They're either acute or chronic, and they tend to be resolved with antibiotics. That's a fairly straightforward diagnosis. If it gets better on a set of antibiotics, it's a bacterial nature. If it keeps coming back, then it's chronic, not acute. The other subset is either an acute or chronic non-bacterial, and that is an inflammation that is not responding to antibiotics, and that means that there's something else going on. Those are the people I tend to see because they've already been through at least 1 or 2 courses of antibiotics, not changing, not getting better, starting to get more pelvic pain. Those are the people I tend to see. And then we figure out what other type of issues we can deal with, things that we can do to decrease the irritation of the prostate, that sort of thing.
Okay, awesome. What about post-surgical, post-prostatectomy? What would your treatment look like then? And should men be seeking that out, or... Okay. Tell me more.
Definitely.
Okay.
Definitely. There's so much we can do for people post-surgical.
Okay.
There is a lot of different protocols out there in our world, or things that we're supposed to follow, or things that have been kind of determined to be the best manner of practice. A lot of the stuff for men is coming out of Australia.
Okay.
In Australia
has always been a bit of a leader when it comes to pelvic health. They're top notch.
They are awesome.
Yeah, even women's health, like they're right on.
Perfect.
Yeah.
So a lot of the protocols that are coming out of Australia actually have these surgical patients coming in and seeing a physio pre-treatment or pre-surgery. So we do a pre-surgical exam, we do an assessment, we give you all the information you need to do, we teach you how to do the proper exercises, what positions to use, what positions not to use, that sort of thing.
Yeah.
And post-surgery, they're actually suggesting that you can start doing gentle exercises with the pelvic floor muscles within hours of your surgery.
Wow.
So yes, you do have a tube in there, but that tube is nice and soft, and
Okay.
They start doing exercises within that. A lot of these physios are checking up with their patients 2 or 3 days post-surgery just to see how things are going, reminding people, and then we actually start active treatment about 10 to 14 days.
Awesome.
Or basically as soon as that catheter is out.
Yeah. So knowing a little bit about what I know about the pelvic floor, especially when we're talking about pain,
right?
I would guess that if you can have early intervention post-surgery, you're probably going to stop or prevent a lot of the pain response and then the pelvic floor response that comes with pain.
Exactly.
That tends to cause more persistent symptoms down the road.
Exactly.
Would that be true?
That's exactly true.
Okay, so I'm guessing that we have a little bit more of a female viewership right now. If you have a man in your life who has had a prostatectomy or is having prostate issues, I think this is when we can step up and be like, hey, I can hook you up with someone who's going to help, and really advocate on their behalf, especially post-surgery or pre-surgical even, and just educating and letting them know that there is something available, and it's very important to seek that out. So, okay, awesome. Tell me a little bit about, let's get into pelvic pain a little bit more, specifically men's pelvic pain. What does that often look like as far as symptoms go? And kind of what does that affect, or is there any kind of carryover that might affect?
So men's pelvic pain, again, very similar to women's in that it can cause low back pain, hip pain. There was a study done out of McMaster University in 2016 that it was done with women, but showed 90% of women with low back pain have some sort of dysfunction with their pelvic floors.
Right.
A lot of men with back and hip pains also have dysfunction with your pelvic floor. So if you're having discomfort there, it's something to consider. Right. One of the signs that a lot of men start to see is they start to have problems with their stream, or they start to have pain when they're trying to have a bowel movement, or they're having numbness in their penis after sex, or those type of things are starting to happen. And those are all indications that something is off with that pelvic floor, something is not working properly, and we need to get it taken a look at.
Okay, let's go there.
Okay.
If someone was thinking about coming for a men's pelvic health assessment, can you walk us through what an initial assessment would look like?
Okay. So with me, what an assessment with me would look like is that you're sent some questionnaires ahead of time. They're to find out your general health, your general history in terms of surgery, other issues, what your present concern is, what your present symptoms are. I also send out a couple of other questionnaires to kind of cover other areas of your life. Because let's face it, if you're having problems with your pelvic health, if you're running to the bathroom all the time, if you're trying to go and you can't go, if you want to have sex with your partner but it hurts, those things can cause other things in your life, such as depression, anxiety, stress. So I send out some other questionnaires to find out if those are present, how great an impact they are, and what we need to do. Because if we can get those under control, quite often we can affect the pelvic floor as well. The next thing we do...
Sorry.
Don't worry about it. The next thing we do is we go and we do an interview. I'm going to get to know you. You're going to get to know me. We're going to get a little bit more comfortable with each other and just explore what's going on with you right now. After that, we're going to just do a general screening exam, take a look at your back, your hips, most of all, see if there's any tenderness in any skin areas, over the abdomen, over the thighs, that sort of thing. And then comes the part that everybody's really thrilled about, which is an internal exam. So with women, quite often that's done through the vagina, and guys, you don't have one. I've only got one, or one way in to feel what those pelvic floor muscles are doing. And I do that, as I tell people, I do that for a variety of reasons. When I take a look at the pelvic floor, I'm looking to see, are the structures still there? Have you had an injury that has torn one of the structures? Are you painful in one of the structures? Is there any scar tissue that's going on? Especially if you have any history of anal fissures or anything along those lines. We take a look at, are there any bulges? Are there any hernias? Is there anything else going that can be contributing to this? Then we take a look at just general tone. Are you really tight and grabbing on, or is it kind of floppy and not really doing what you needed to do? After that, we take a look at strength. Just straight off, what are you able to do down there? And then we also add in endurance. So we take a look at all those factors to try to figure out what's going on with you. After that, we come up with a treatment plan. I usually follow up with people in about a week, and then we progress from there and see where we need to make things more difficult, less difficult, work on a little bit more specifics.
Thanks, Cara.
No problem.
I'm totally getting over a cold. I thought I would be fine for this interview. I don't want to cough in your faces, so. Anyway, yes, awesome. Thank you for going through that.
No problem.
I think, I mean, we know that there's a lot of angst and even anxiety, even when we're talking about women's health, right? And I feel like women's pelvic health has been very forefront on social media, in the news, in magazines even. People are talking about it a lot more now than they ever have.
Yep.
And there's still a lot of, I don't know, like, yeah, just angst, I guess, and nervousness for women to come. How can we as women support the men in our life and encourage them, to come and seek out care when it's needed?
I think the biggest thing to reinforce is that this is not that uncommon. Men think I'm the only one going through this. This is something strange. This is something weird.
Yeah.
It's not. It is a very common problem. The other thing that men tend to think is as soon as something's wrong down there, it's prostate cancer. It's got to be prostate cancer. There's so many other issues that can be happening that are not cancer.
Right.
That are, like I said, once we get to the root of the problem, come up with a plan, can be fairly easy to deal with. So just supporting them, helping them realize they're not alone in all of this and that there is help. They don't have to just sit and suffer. Because there's so many men out there that are just sitting and suffering through it because they figure, I'm a man, I just got to put up with it.
Yeah.
I also think it's the area. It's a very private area. A lot of guys, don't have anyone other than their significant other dealing with that area all that often. The old glove finger is about as close as they get, and getting past that barrier can also be something else to deal with.
Yeah. And I think too, just education. I know when dealing with women's pelvic health, sometimes, what we don't know scares us usually. If we don't have good information, we feel, fear or shame. And I think that probably rings true for men's pelvic health as well. What they don't know, it feels really scary, and it is a vulnerable thing. So, yeah, for sure. Is there anything else that you'd like that I haven't asked that you're kind of dying to get out there as far as information on men's health?
I think you pretty much
that was a good little summary. Hey? Yeah.
Pretty much covered it.
So, Cara, if people are looking to seek out your care, how can they get a hold of you? And maybe if they're not ready to come in for an assessment, but they just want to maybe talk to you first, is that an option to kind of feel that out?
Absolutely.
Okay, so maybe if you could just give everyone your contact information, or just let us know how we can get a hold of you.
So I do work for Pursuit Physiotherapy. Their phone number is 403-356-9789. That takes you to our front desk. You can leave a message with them, or just say, I'm a guy. I want to talk to I want to talk to Cara. I want to talk to a pelvic health therapist. They'll pass the message on to me. I'll get back to you as fast as I can. If you'd rather send an email, the best way is to send it to our main email address, which is info@pursuitphysio.com. It will get forwarded to me, and then I can get back to you as quickly as possible.
Perfect. Thank you, Cara, so much for being with us. And I hope that everyone watching will take advantage of this awesome resource that is in our community. Cara, does a great job, and I'm glad that you all got a chance to meet her and know that this is someone that you can access right here in our community.
Thank you very much.
Yeah.